All right, there's a bigger picture with joint health. You may have achy, creaky joints. Your joints may sound like a machine gun in the morning. You may find when you get up out of a chair after sitting still for a long time or taking a long drive that you can barely unfold your hip because it's so stiff. But it's a bigger problem worldwide. 15% of the global population over the age of 30 has osteoarthritis. We think there's going to be 1 billion people with this problem by the year 2050. Now, I know we hear huge numbers tossed around all the time, but 1 billion, if you really think about 1 billion, that is a tremendous number of people running around with arthritis. In 2019, there were 528 million people with arthritis, which was a 113% increase in the prevalence of arthritis since just 1990. Now think about that. What is that? 20 years? Just about? Am I getting my math right? 30 years? So over a space 20 to 30 years, 113% increase in osteoarthritis, but yet all of our activity levels have gone down. Our medications presumably have gotten better, and our treatments in terms of orthopedic have improved. These numbers are not computing in my head, so I think there's a bigger picture we're missing here. The most common joints to be reported as affected by arthritis are the knee, the hip, the hand. Females seem to complain about the symptoms of arthritis more than men. So the prevalence seems higher in females than men. It's about a 60-40 ratio rather than 50-50. About 20.9% of US adult women have osteoarthritis. That's 1 out of 5. And then 16.3% of the men. Veterans, I'm a veteran, I'm a female, I'm in the older age group. So you would think I'd have arthritis, but I don't, but I'm in all the risk groups. Veterans seem to have it more than non-veterans. And the importance is, it's a huge economic burden, not to mention the quality of life and depression things we just talked about. There's a loss of productivity in the workforce. There's huge amounts of costs associated with this and a lot of time and effort spent in medical care. And again, we still have no cure. And then there's heightened amounts of what are called transfer payments, because this is one of the most common reasons for people to go on disability and stop working. So even the ones that are still working aren't as productive. And then a lot of people just stop working because of the debilitating effects in terms of the pain and the stiffness and the loss of function with osteoarthritis. So by 2050, 78 million Americans are going to have this problem. And again, 1 billion worldwide. So we got to get a handle on this. And I don't think lifetime injections of recombinant proteins is really the best answer. I think we can do it a little bit more holistically and naturally, and then, God forbid, if you need one of those injections, you'll get it. It should be more effective.